Welcome to Fusion Occupational Health, Audiometry and Noise-Induced Hearing Loss. This video tells you about the control noise regulations, noise and its impact on hearing, how to recognise signs and how hearing loss impacts our lives, the difference between hearing loss and noise-induced hearing loss, what the screening process is, ways to control noise exposure and prevent hearing loss, and our complimentary manager's helpline. The Control of Noise at Work regulations were introduced in 2005. The secondary legislation was designed to protect workers' hearing from damage caused by excessive noise in the workplace. The regulations set out specific exposure limits and action levels for noise, which employers must assess and control. They also place a duty on employers to provide health surveillance, including audiometry, where workers are exposed to noise risks so that early signs of hearing damage can be detected and managed. Did you know that millions of workers are exposed to hazardous noise on the job every day? Noise-induced hearing loss is the number one occupational disability for the British worker. Hearing loss from noise is slow and painless. You can have a disability before you even notice it. It is progressive over time, it is permanent, and importantly, it is 100% preventable. 1 in 4 individuals aged over 16 have a hearing deficit. You may be surprised to learn that some common sounds are louder than you think. From using the vacuum cleaner to heading out to a nightclub, individuals have more exposure to loud noises than you might realise. So what causes hearing loss? It could be a number of things. Age, exposure to loud noise, certain medications and chemicals. It could be hereditary, from a head injury or trauma, excessive headphone use, childhood illness, frequent ear infections, or even a tumour. Hearing loss isn't always permanent. Temporary hearing loss happens after short-term exposure to loud noise. For example, after working in a noisy environment or attending a loud event, sounds may seem muffled or your ears may feel blocked. The key point is that hearing usually returns to normal once the noise stops and the ears have had time to recover. Common causes of temporary hearing loss include sudden exposure to very loud noises such as machinery, alarms, or impact tools. Short periods of loud continuous noise, for example power tools or equipment without hearing protection. It could be exposure to loud music either through headphones or at events, or inadequate or inconsistent use of hearing protection. While temporary hearing loss may seem harmless, repeated episodes increase the risk of permanent damage over time. Permanent hearing loss, on the other hand, develops from long-term exposure to moderate or high noise levels. This damage builds up gradually and cannot be reversed. Once hearing is lost permanently, it does not recover, even when noise exposure stops. This is why controlling noise exposure using suitable hearing protection and carrying out regular hearing checks are essential in the workplace. Common symptoms of hearing loss include speech sounds being distorted or muffled, difficulty understanding speech, especially with background noise, ringing or buzzing sounds in the ear, difficulty hearing on the telephone, the need to have the volume loud on the television or radio, frequently asking people to repeat themselves, and difficulty hearing some pitches, usually high frequency. Whilst employees might have difficulty hearing warning signals on the job, an increased risk of falling, and difficulties in communicating, it's not just in the workspace effects of hearing loss happen. It could also contribute to loneliness and depression, give low self-confidence, increase stress, so blood pressure, hypertension and cardiovascular disease. It may lead to nervousness, sleeplessness and fatigue, and also tinnitus. We only have one set of ears. It's incredibly important that we take care of them. What is the difference between hearing loss and noise-induced hearing loss, or NIHL. Well, NIHL is hearing loss that has been directly caused due to frequent, prolonged exposure to loud noises. On the screen, you will find 2 examples of hearing tests. Test 1 is an example of a test for an employee's hearing who is perceived to be normal. Their hearing is well within the parameters for their age, and there are no dip trends at 3, 4 and 6 kHz. Test 2 may look similar to Test 1, however, you can see there are clear 10 decibel dips at frequencies 3 and 4 kHz. These dips then follow with a recovery of 10 decibels. This is how possible noise-induced hearing loss is identified as set out by the HSE. Once NIHL is suspected, it becomes a statutory health surveillance issue rather than a routine screening outcome. This distinction is recognised in occupational health practice and reflected in how audiometry results are categorised and escalated within health surveillance programmes. A GP can diagnose and treat hearing loss as a medical condition, but they cannot assess whether the hearing loss is caused or worsened by workplace noise, nor can they advise an employer on their legal duties. An occupational health physician, or OHP, is specifically trained to assess work-related causation, interpret audiometry in the context of occupational exposure, and provide advice that ensures the employer meets their health and safety obligations. Here are some other examples of NIHL on a more moderate to severe scale. And here is an example of some hearing tests that warrant a referral to their GP. Noise-induced hearing loss is caused by multiple things, whether it's occupational noise, recreational noise, impulse noise, or environmental noise. When screening your employees, there is a list of actions our technicians follow to ensure the best quality of results are obtained. Starting with checking their equipment for any visible, obvious damage, checking the frequencies are coming through clearly, and that it has been calibrated within the last 12 months. Next, they will check the decibel levels of the testing room, ensuring it is suitable. Technicians will then go through a series of questions that will capture current information as well as the history of patients' ears. This includes information like noisy hobbies, previous noisy employment, history of ear disease or trauma, anything that is important to understand the history of their ears. Clear instructions will be provided on how to complete the test successfully. The test conducted is through automated testing software. Whilst completing the test, the technician will observe the employee and the results as they respond, ensuring the results are as accurate as possible and that no tampering is evident. They will also continuously monitor the environment. After the test, if necessary, technicians will recheck the frequencies. They will review the preliminary results and advise if there are any actions that are required at that time, such as GP referrals or potential escalations to an OHP. The test results will be submitted for a secondary quality check, and the final result will be issued to management through our occupational health portal. So, what's the process? Well, if a hearing test indicates there are possible signs of noise-induced hearing loss, we'll need to make sure we have a secondary set of results to compare this to. This could be an existing previous test that does not predate 3 years, or we may have to recall them back in 6 weeks' time to obtain a secondary set of results if this is their first time seeing occupational health. If the possible noise-induced hearing loss is present, it needs to be put forward to be reviewed by an occupational health physician. The OHP doesn't actually need to speak to the employee. They will use the extensive question set that is asked by the technician, along with the evidence of the audiometry results, to produce a report that will be made available to you on the OH portal. The report will indicate the next steps that you may need to follow such as more frequent testing to ensure there is no further decline. The changes that we have implemented will keep you in compliance of your requirements under the HSE guidelines for audiometry testing. Some small changes can make a big impact. An increase of 3 decibels means that sound intensity has doubled. A worker's exposure to noise should be controlled below a level equivalent to 85 decibels for 8 hours to minimise occupational noise-induced hearing loss. By reducing employees' exposure to noise by 3 decibels, it will halve the intensity of the sound. At a minimum, you should be ensuring employees are wearing adequate hearing protection and encourage them to come forward if there are any issues with it. You should offer training and educate your employees on the importance of protecting their hearing, making sure they know how to wear it correctly and reminding them that they only have one set of ears. Promote them to engage with their health surveillance programme and do a daily walkthrough to ensure controls are working. Monitor your noise levels regularly and provide clear, concise warning signs and instructions on how to manage their ears and their hearing in the workspace. Don't forget, you can use our complimentary manager support line. You may have some questions about noise-induced hearing loss, or you may just need some advice on something else that is clinical. Please don't hesitate to reach out. Thank you.